everyone, welcome back to my channel. In this video, we will solve some practice questions from CPT. This is very important for the CPC exam. This video is part 4. To solve some more practice questions related to CPT, you can check the playlist CPT Practice Questions Series. I will also mention the link in the description. Let's start with the first question for today. Read the question. A patient has nasal polyps removed from both sides of her nose. A total of 3 polyps were removed. How should the physician services be reported? So, in the options you can see they have mentioned 30110 and 30115. In option C again 30110 and in option D 30110. So first let us check between these two codes which is the right one. Check the codes 30110 and 30115. 30110 is for excision nasal polyps simple and 30115 is for excision nasal polyps extensive. When you look at the question, a patient has nasal polyps removed from both sides of her nose. A total of 3 polyps were removed. So that's all they have mentioned. They have not mentioned that it is an extensive procedure. So in the absence of documentation that this is an extensive procedure, we must assume it is simple. Okay, so we have to code for simple, not extensive. So eliminate the code 30115. That is option B. Now we are left with option A, option C and option D. Below the code 30110, there is a parenthetical note. To report bilateral procedure, use 30110 with modifier 50. So here it is a bilateral procedure because they have mentioned both sides of her nose. So we have to append modifier 50. Therefore, option D is the right answer. Though they have mentioned 3 polyps in the question, the number of nasal polyps excised does not affect the reporting because the code description mentions polyps, right? So it may include multiple polyps. So we need not multiply 30110. Therefore, option D is the right answer. Let us move on to the next question. Read the question. Mrs. Johnson underwent outpatient surgery for repair of a fractured left turbinate. The surgeon ended up having to completely remove the left inferior turbinate using a surgical drill to sever it from the lateral nasal wall. The procedure involved only mucosal nasal tissue and did not extend into the submucosal tissue. How should the physician services be reported? Let us check the options. In option A, B, C and D, they have given 2 codes, that is 30130 and 30140. So let us check these 2 codes. The code 30130 is for excision inferior turbinate, partial or complete, any method. And the code 30140 is for submucous resection inferior turbinate, partial or complete, any method. In the question, they have mentioned the procedure involved only mucosal nasal tissue and did not extend into the submucosal tissue. But the code 30140 is for submucous resection. So we should not code 30140. We'll eliminate option B and option D, which has the code 30140. Now we are left with option A and option C. The code 30130 is correct. In option C, they have appended modifier 22. So what is modifier 22? Modifier 22 is for increased procedural service. But according to the scenario, it's not appropriate to report the modifier 22 based on the information provided because though they have mentioned use of surgical drill, it is not a complicated procedure because a surgical drill would always be used for this kind of procedure. And we should not append modifier 22 unless the documentation clearly specifies that there was something about this procedure that made this procedure unusually complicated. Therefore, we should not append modifier 22 in this case. I repeat, in the documentation they have not mentioned complicated procedure. or any increased procedural service. So we should not append modify 20 to eliminate option C. Option A is the right answer. They have mentioned LT, that is for the left side. I hope you're clear with it. Let us move on to the next question. A physician performs a diagnostic colonoscopy through a stoma. During the colonoscopy, the physician removes a foreign body from the colon through the scope. How should these services be reported? Let us check the options. Check option A, 45379, that is for colonoscopy flexible diagnostic including collection of specimens by brushing or washing when performed with removal of foreign body. And the code 44390 is for colonoscopy through stoma diagnostic including collection of specimen by brushing or washing when performed with removal of foreign body. Okay. And in option C, the first code 45378 is for colonoscopy flexible diagnostic including collection of specimen by brushing or washing when performed. And in option D, the first code 44388 is for colonoscopy through stoma diagnostic including collection of specimen by brushing or washing when performed. So which among these four codes is the right code? The right code is 44390, which is in option B, because that is for colonoscopy through stoma. And in the question you can see they have mentioned diagnostic colonoscopy through a stoma, and 44390 is also for colonoscopy through stoma diagnostic, and it is with removal of foreign body. So here they have mentioned during the colonoscopy the physician removes a foreign body from the colon. So 44390 is the right code. Now we'll check why other options are wrong. Option A 45379 is wrong because that is for colonoscopy flexible diagnostic including collection of specimen with removal of foreign body. But in the question they have mentioned colonoscopy through stoma, right? But the code 45379 is for colonoscopy, that is examination of the entire colon from the rectum to the cecum. Okay, but here they are performing colonoscopy through a stoma. So we have to use the appropriate code. We cannot code 45379, eliminate option A. Similarly, option C also will be wrong because that is for colonoscopy from rectum to the cecum. It is not through stoma. So eliminate option C also, because if one code is wrong, the entire option will be wrong. We'll eliminate option D 44388 along with 44390, because the code 44390, which is the right code for this question, it already includes all the information from 44388, because 44388 is the parent code and 44390 is an indented code. Therefore, 44390 includes all the information from 44388. We need not code it separately. It is wrong. So eliminate option D. Option B is the right answer. Let us solve another question. I share important tips and tricks to clear your CPC exam in the first attempt. So don't forget to show your support to my channel by liking, sharing and subscribing to CodeMed Mastery for more information related to CPC exam and medical coding. Read the question. Two surgeons working together perform a partial esophagectomy with cervical esophagostomy without reconstruction. How would these services be reported? In option A, B and C, they have given the code 43124. So 43124 is for total or partial esophagectomy without reconstruction with cervical esophagostomy. In the question also they have mentioned partial esophagectomy, that is correct, with cervical esophagostomy, that is also correct, and without reconstruction is also mentioned. So 43124 is the right code. In option D, they have mentioned 43122, that is for partial esophagectomy, thoraco-abdominal or abdominal approach with or without proximal gastrectomy with esophagogastrostomy, with or without pyloroplasty. That is the wrong code, because we have to code for partial esophagectomy, and that is without reconstruction with cervical esophagostomy. That is not mentioned in the code 43122. Therefore, we'll eliminate option D. Now we are left with option A, option B and option C. In option A, they have appended modifier 51 with the code 43124. In option B, there is no modifier. In option C, they have mentioned 43124 with modifier 62 for one surgeon and 43124 with modifier 62 for the second surgeon. Modifier 62 is for two surgeons. And in the question, they have mentioned two surgeons working together, right? Therefore, we have to append modifier 62. So, only option C has the modifier 62. So, option C is the right answer. That is 43124 with modifier 62 for one surgeon, 43124 with modifier 62 for the second surgeon. We'll eliminate option A and option B. We cannot append modifier 51 in this case because modifier 51 is for multiple procedures. But here, two surgeons are working together to perform this particular procedure. So we cannot append modifier 51. I hope you're clear with it. Let us move on to the next question. Read the question. A surgeon administers general anesthesia on a 70-year-old male prior to performing an emergency partial hepatectomy to control hemorrhage. How should surgeon services be reported? So here they are asking for surgeon's services. Okay. In option A, B, C and D, they have given the code 47120. 47120 is for hepatectomy, resection of liver, partial lobectomy. In the scenario, you can see they have mentioned partial hepatectomy to control hemorrhage. Therefore, 47120 is the right code. In the question, they have mentioned surgeon administered general anesthesia on a 70-year-old male prior to performing emergency procedure, right? So, regional or general anesthesia provided by a surgeon may be reported by adding modifier 47 to the procedural service because modifier 47 is for anesthesia by surgeon, right? Therefore, we have to append modifier 47 in this case. And the right answer is option B, 47120 with modifier 47. In option A, they have mentioned HCPCS modifier AA, that is for anesthesia service performed personally by anesthesiologist. But in this case, the surgeon is administering anesthesia. So we cannot append HCPCS modifier AA. So we are eliminating option A. Now coming to option C and D, they have mentioned anesthesia codes, that is 00792, 99100, 99140, right? But in the question, they have mentioned how should the surgeon's services be reported. So, anesthesia codes are not reported by the surgeon, and qualifying circumstances codes and add-on codes should be used only with anesthesia codes. They are not reported with surgery codes. This code 47120 is a surgery code, right? So, along with that, they have mentioned the anesthesia codes. But according to the guideline, the anesthesia codes are not reported by the surgeon, so we'll eliminate option C and option D. Option B is the right answer. So that's it for today. In the next video, we'll solve some more questions related to CPT. So stay tuned.